Thanks for staying with us. Welcome back to Power Lunch West Africa. Now, the COVID-19 Action Fund for Africa, also known as CAF-Africa, is a collaborative body of over 30 organizations with a mission to provide personal protective equipment to community health workers in support of the fight against COVID-19 in Africa. Tapiwa Mukwashi, director of the supply chain at VillageReach, who also doubles as a lead for the supplies working group of the COVID-19 Action Fund for Africa, joins me to discuss their work across Africa. Tapiwa, thank you for joining us today. Let's get right to it. Help us understand the work that the COVID-19 Action Fund for Africa does in helping to protect community workers in this pandemic.
Thanks, Esther. Thanks for having me on this show. I think CNBC Africa is a good program and everyone must watch it. I thank CNBC Africa as well for providing this opportunity to amplify our message that community health workers are important, cadres in the health system. They're important in that they provide services at those difficult instances in communities where nobody has the time or resources to reach, and they stay there. They are trusted by the communities. And so Africa, the COVID-19 Action Fund for Africa, exists because there is a problem, a huge problem. Community health workers do not have access to PPE that they need to be able to provide safe services, routine services that they have always been providing. There is no PPE that will enable them to make a difference in the communities and bend the curve in terms of the COVID cases that we're experiencing. So the COVID-19 Action Fund for Africa brings together 30 organizations in over 20 countries in Africa for the sole purpose of mobilizing resources to equip community health workers and to make sure that those resources, wherever we source them, we're sourcing them from China, we're sourcing them from the United States, we're sourcing them from Thailand, and we're providing those mechanisms that allow for the PPE to reach those hard-to-reach areas with the support of government, with the support of community health actors. So we are very excited. I do not want some of the big numbers that we will talk about on this show to frighten people, but thank you for this opportunity.
Now, I know that today the Emergency Fund has committed and delivered over 57 million PPE across the continent, but I'm interested to know those, you talked about some hard-to-reach areas. What countries where are we finding those communities that are experiencing real shortages in PPE?
Esther, the shortages are widespread. The shortages are in the greater part of Africa. All the 20 countries that we're talking about, Mozambique, the Democratic Republic of Congo, Liberia, Nigeria, Ghana, Ethiopia, Kenya, some big names that you think would not have challenges. But, there's just one problem, that community health workers were not being prioritized. And so in this initiative, we are finding an opportunity to help and work across all those governments to prioritize and integrate community health workers into their planning. So we're finding us delivering PPE through canoes in the DRC, for instance. We have just shared a photo story that shows some of the terrain on our CAF-Africa, CAF-Africa.org, that shows the terrain that we have to cross to get the PPE across the most difficult locations. I want to mention again, Esther, that PPE is bulky. And for a country like DRC, we're having to deliver 720-foot equivalent units. This is a mountain, this is huge. And to make sure that these millions of pieces of PPE actually get to where they need to be used, it's not easy. We need, outside the terrain, there is shortages in storage space, there is shortages in transportation capacity. So we're finding an opportunity to mobilize all actors in this space. We're working with the private sector to clear, to store, to transport. We are getting the commitment of government to fund, to clear without duties some of these PPE. So this is a huge and tremendous opportunity to deliver over 200 million pieces of PPE to close to 1 million community health workers in Africa. So these community health workers by design save communities that are 20 to 30 kilometers away from the nearest health facilities, and this involves crossing rivers and traveling in densely forested areas. So the bigger part of Africa, Esther, is very hard to reach. And this is where community health workers are providing life-saving services.
Tapiwa, we also knew that, yes, 57 million PPE have been delivered, but this is going to continue. You will continue delivery through March this year. What happens after March, or are you ending in March? Help us understand.
Esther, we have planned this in phases. So March marks the end of the phase one that was targeted at mobilizing the resources. Post-March, we want to be systematic. We are working together with all the partners, with the governments, with our donors, to see how we can make this sustainable, how we can make this long-term. Community health workers need PPE now, urgently, and that's why we're talking about March. But community health workers are going to need PPE into the future, and these are the discussions that we are having to redesign our approach so that we're more systematic, and we look forward to continuing to provide PPE to community health workers into the future. So March reflects on the agency, but this is certainly not a short-term initiative.
So what about funding? I know that funding is a key part of your operations. Tell us about funding, challenges you're having, and what is the plan on the table to get more funding?
Thank you. Our bold goal is to raise $100 million to supply PPE to community health workers over 12 months. To date, we have raised under 20 million. This is an initiative which was launched in August. So we still have 80 million to go. We've been fortunate to get commitment from Direct Relief. We have anchored all our fundraising efforts by committing 10 million to get the activities going. We have a number of donors that are continuing to provide us support. So I think coming out of this show, it's important that once we amplify this message, we are calling our private sector, we are calling on more donors to act, to provide resources that will enable us to achieve this big, bold goal that will allow us to protect community health workers and to protect people in our communities. I must say, Esther, if community health workers are not safe, no one is safe. And so this, if nothing motivates you, being safe should be enough reason to motivate you.
Tapiwa, thank you so much, and of course, all the best with the operations going forward. Tapiwa Mukwashi, Director of the Supply Chain at VillageReach. Over now to the markets here in Nigeria.